When we start to talk about the effects of the different medications on the person's body, two terms are important to remember: pharmacotherapy and pharmacodynamics. Pharmacotherapy is the knowledge and use of drugs to produce a therapeutic effect on the body. The therapeutic effect is considered the beneficial effect, the reduction of symptoms, the reduction of the condition, the reversal of the disease process. Pharmacodynamics are the mechanisms of action by which drugs produce their effects, and this is based on both time and on dose. Something to think about while we're looking at this whole concept is the concept of receptors. Receptors are specialized levels of cells that are designed to react to when another combination of cells or chemicals interact with those cells. These are known as receptors, and drug effects can be extended through these receptors. These are special protein molecules located on cell membrane of every cell. And this means that drugs' effects can be exerted through these receptors. These receptors are specifically designed to interact with natural body chemicals, such as hormones or enzymes or neurotransmitters. And if we imitate or closely imitate those chemicals, then we can have those receptors interact with the medications or drugs that we give these patients. An idea to think about is the whole lock and key idea. The drugs are the key, and that means that certain drugs can unlock, that is, activate certain receptors. And this means that if I have chemicals that are similar, that is, drugs that are similar to each other, they're going to produce similar effects. An agonist drug is a drug that is able to unlock and then to activate a receptor. It produces an effect. So an agonist drug causes the receptor to activate. An antagonist is also known as a blocker drug. Some medications or drugs fit perfectly with the key, but they cannot unlock that receptor. They cannot activate the receptor. And further, they prevent other chemicals from coming and activating that receptor. So this is why we refer to them as blockers. The therapeutic action is to occupy the receptor site and prevent the receptor from activating. So they block hormones, they block neurotransmitters, and they also block other drugs from using or activating that receptor. Now, one medication can act as sort of a master key, and this means that it unlocks several different receptors in different organs and different tissues. This all accounts for the therapeutic effects of the drug and also the various side effects of that same drug. If I'm targeting the lungs and the liver and kidneys are also affected, these can explain some of the unexpected effects or side effects of those medications. Now, what type of receptors are there? There's adrenergic receptors. These respond to the sympathetic nervous system. There are cholinergic receptors. These respond to the parasympathetic nervous system. And there's histamine receptors. And these are involved with the immune response.